Hi, I'm Dr. Matt Walton.
And I'm Dr. Ashley Karcheski, but you can call me Dr. Ashley.
Today we're going to be talking about sedation in dentistry, what the various types of sedation are, and we'll explain a little bit about each procedure.
Great. So, what are my three options for sedation?
Well, the first is nitrous oxide or laughing gas. The second is oral sedation, where you take pills. That's also called enteral sedation. And the third is intravenous IV sedation or parenteral sedation. And that's where the medication is administered directly into the bloodstream.
Great. Can you tell me a little bit more about the laughing gas? I've heard of that before.
Yeah, laughing gas has been around for a long time. Most people are familiar with it. It's called nitrous oxide. It's very safe. And the nice thing about it is that you can drive home afterwards.
Awesome. It feels kind of like a glass of wine or two, right? Just takes the edge off.
Yeah, it takes the edge off. It makes you a little relaxed. And it's very safe.
Great. So, if I want a little bit more sedation and I want to go the pill route, what do I need to know about that?
Yeah, with the oral sedation, it's very common these days. That's where we administer one or two pills ahead of time. And then for some people, it makes them quite sleepy. Some people would call it a twilight type of sleep. The nice thing about that is a lot of times you won't remember a whole lot about the procedure.
Great. And if I want even more sedation, what do I need to know about IV sedation?
So the next step would be intravenous or IV sedation. That's where we put an IV in your arm and administer the medication directly into the bloodstream. It's very safe and you'll be monitored throughout the procedure, but it's important that we follow certain rules and regulations ahead of time.
Awesome. So, what do I need to know about food and liquid restrictions before I undergo IV sedation?
So with the IV sedation, it's important that you don't have anything to eat 6 or 8 hours ahead of time.
Okay.
You can drink, but it has to be clear fluids like water or apple juice.
Not vodka.
Not vodka. And as a matter of fact, we don't want you to consume alcohol ahead of time.
Great. And what should I wear to my IV sedation appointment?
Great question. We want you to be comfortable. Make sure you wear loose-fitting clothing. A t-shirt is fine, or if you want to bring a sweatshirt in, that's fine. Just make sure it's a little bit baggy and that we can roll up the sleeves or even take it off because we need to get to your arm.
Great. So, can I wear my nail polish or do I need to take that off beforehand?
You'll need to take that off. Unfortunately, we can't have nail polish on there because it interferes with our measuring of your pulse oxygen.
So, Dr. Walton, I take some medications. What do you suggest I do about that?
So go ahead and take all your medications as you normally would, unless instructed otherwise. Again, you can have those clear liquids such as water or apple juice. So go ahead and take them unless you're told not to. Some other restrictions might be you need to have a driver here. So that somebody will need to drive you here, whether it's the oral sedation or the intravenous sedation.
Great. And in terms of weed or marijuana, what do I need to know before I undergo the IV sedation, and what should I do after about that?
Great question. A lot of people use cannabis containing products these days, very common. We don't want you to ingest any sort of marijuana containing substances for at least 2 weeks ahead of time. The reason being is because your safety is our number one priority and it can interfere with the medications that we give you.
Great.
What are some of the post-operative things you can expect and do's and don'ts afterwards, Dr. Ashley?
Yeah, so after IV sedation, or if you take the pill sedation, you can't drive afterwards for up to 24 hours. And you really need someone there with you for 6 to 12 hours after the procedure to monitor you to make sure everything is safe.
That's right, yeah. We don't want you to consume alcohol afterwards either. And again, stay away from those cannabis containing products for at least 4 or 5 days afterwards.
Yeah, we care about you.
That's right.